welcome to Time for Health. We're very glad you've joined us, and as always, we talk about a topic here that hopefully is useful for you, or maybe you can share the information with somebody you know and love. Today we are talking about cancer screenings with Lindsay Damschroder. Thank you for being our guest here.
Thank you for having me.
You are a nurse practitioner.
Yes.
And you work primarily in oncology.
Yes.
Hence the reason for my invitation for you to come and talk to us today.
Yeah.
So we wanted to talk about cancer, but that is a ginormous topic overall.
Sure.
And so we kind of narrowed it down to cancer screenings. So why is it important to screen for all the different kinds of cancer that we can screen for?
Yeah, right. So, cancer screening in and of itself is designed to screen individuals kind of in the absence of symptoms. In healthy individuals that otherwise are feeling well, doing well, but don't have any symptoms. The diagnostic type of testing is done once a patient has symptoms.
Gotcha.
Screening is designed to kind of, and obviously catch things early on when things are more amenable to treatment and we have better successful outcomes if we find these things early.
That I'm picturing, yes, the reason we screen is to catch it early because it's easier. A lot of things are easier to treat. I just did a show on diabetes, and it's the same thing. There's a risk test for pre-diabetes now because it's easier.
Sure.
You can reverse that kind of stuff or
Sure.
treat that stuff so it doesn't turn into that. So same thing
Right.
with cancer.
Right.
Is we
Absolutely.
screen because the earlier you find something, the better the chances of it being able to be treated.
Correct.
Okay.
Yes.
Now, there are so many different types of cancer, and I don't know if all of those types have a kind of screening, but what types of cancers do have screenings, or what kind of screenings are out there?
Yeah, so just to kind of give a little, brief summary of what screening tests are. I mean, these are basically tests that have been studied extensively over time, and they've been deemed to be safe and effective and useful. And then they're kind of, if there's sufficient enough evidence found, these screening tests are then adapted into what we call standard of practice, standard of care, those kind of things. And there's different guidelines by different, I think we talked about that a little bit. There's different guidelines based on those, basically the information that you have out there. There's a lot of information now on the internet. It can be very confusing as to what, what guidelines do you go off of. I will say primarily in my practice and the physicians that I work with in our group, we primarily go off of something called NCCN guidelines, which stands for National Comprehensive Cancer Network.
Okay.
Say that 10 times fast.
Yeah.
But basically, panel of experts comes together and kind of comes to a general consensus as to what is the best standard of practice. So the ones that probably most everyone is familiar with, the top three that I would say are going to be your colonoscopies or any kind of colorectal screening, mammograms for breast cancer, and then of course Pap tests for cervical cancer. Those are probably the best examples of what we have. So
and who, I guess, maybe go through those or any others that you know of, like what are the recommendations now? And I know we were kind of talking about that before we started taping, like it changes all the time.
Right.
Again, because it's based on research, and so the more research you do, the more you learn, and so then the guidelines might change. So.
Absolutely.
Yeah.
And so, we will talk specifically about the cancers. We'll kind of hit the high points with those that have accepted screening methods.
Sure.
And I will preface this too by saying that when we're discussing this here, this is going to be for average risk patients. Yeah. Of course, there's going to be some outlying special situations where patients, have a family history, maybe a personal history, other types of risk factors that, there's always, it's not set in stone. These are simply guidelines and recommendations, but, so, in regards to screening for, the average risk adult, we'll start with breast cancer. It's Breast Cancer Awareness Month.
We're taping this, it is.
And at least for a few more days.
Yeah.
And we're going to go in ABC or alphabetical order.
Oh, you go right ahead.
So I have kids, so I say ABC order.
There you go.
Right? So the first one is going to be breast, and screening mammograms are recommended. you know, kind of across the board with all the guidelines that you look at,
Sure.
around the age of 40.
Okay.
You know, a patient should be offered their first screening mammogram at the age of 40. If for some reason that does not happen, say a patient does not have a screening mammogram in their 40s, they should have one no later than age 50.
For sure.
For sure.
Okay.
Yes. And this goes through till about the age of 75 with the recommendations, and then they kind of, again, personal decision, kind of that shared decision-making process between you and your provider as far
Gotcha,
as
yeah.
how, you know, do we keep doing
want it,
these? You know, certain people at 75 are very robust and have, you know, can certainly live a whole lot longer. So, you know, there's those kind of considerations. And I will touch briefly too on self-breast exams.
Okay,
I know
yeah.
this has kind of been confusing.
Yeah.
I know to myself in the past,
Sure.
and when I was first getting into medicine, is if you look across the board, there's actually nobody that recommends essentially doing self-breast exams.
Gotcha.
They more talk about this concept called breast awareness, and specifically NCCN kind of defines that as, you know, just kind of being aware of your body, knowing if there's any changes, and kind of reporting those changes promptly if you notice things. And the reason for that, you know, I kind of scratched my head with that, is, you know, they were finding that patients were over-finding things and going to their provider, and there was a lot of unnecessary testing and a lot of unnecessary biopsying that was occurring that didn't necessarily change the mortality rates for breast cancer. So so that's kind of an interesting one. The next one that we'll talk about is cervical. Again, this is one that this has a lot of moving pieces and parts, and it's changed over the years. But just kind of in a nutshell, you know, cervical testing should start at the age of 21. There's really not an indication for it before the age of 21. So before the age of 21 to 29, they recommend having something what they call, a Pap test, but they call it cervical cytology, which is basically just looking for the abnormal, or the presence of abnormal cells or abnormalities. After the age of 29, starting at the age of 30 to age 65, they recommend having a primary HPV test. And an HPV test is primarily looking for the human papillomavirus, those that are known to cause cervical cancer, or there's a higher risk of developing cervical cancer with these certain types. So that should be done every 5 years. And then if that is not available, I know some offices don't, I shouldn't say some, I don't actually know. But when you're reading through this, if that is not an available option, a primary HPV test, in addition to a Pap test, to be done every 5 years, or just having a Pap test every 3 years if you're not able to have the HPV testing. It's a little confusing.
It is confusing, but you know, this is a good time to pause and say, that's why there are professionals like you or whoever your primary care provider is. You know, they know you, they know your family history. That even complicates it more, your personal history, your family history. But they, you know, they kind of keep up on the guidelines, or they ask colleagues, what are the newest, you know, that kind of stuff. So this is, I wanted, you know, to do this, to have this information out there, but it's not like we have to keep track of every little thing and constantly be scouring the journals or whatever.
Absolutely. Good point. Good point. So yes, and then after the age of 65, there's really not a recommendation for it unless you have a, you know, a previous history of a pre-cervical cancer that was serious. They do recommend screening for at least 25 years after that diagnosis, and that may extend even past that age, 65. And of course, that wouldn't apply to those that have had, you know, hysterectomy or total hysterectomy when the cervix has been removed in that. And another thing too with the HPV vaccination. You know, I know that's something that has been around a while, and I know a lot of the younger people now, you know, are starting to receive that. That is not a protection against, you should still do your regular screening
Screenings, okay.
at the recommended age,
Sure.
even if you've been vaccinated.
Okay.
So the next one I'll talk about is colon cancer.
Okay.
This one we talked a little bit about.
Yeah.
Is an interesting one because we're seeing some kind of shift in the way that this has been diagnosed over the past several years. So the new recommendations around May of 2021 moved colorectal cancer screening from the age of 50, which is what primarily
Yeah.
was recommended,
Okay, I
I
remember that.
believe when I started, to now age 45.
Okay.
And so, there are different types of screening tools and modalities for colon cancer, screening colonoscopies, sigmoidoscopies. There's also the fecal occult blood tests and some of
Yeah.
those DNA tests that are being developed and given, I think, in some of the primary care offices. Certainly if you have a family history or a strong family history, I would
Yeah.
caution with that. We prefer, direct visualization in some people
Right.
that are at higher risk, and that's going to,
Sure.
essentially be a colonoscopy.
Okay.
So, and I just kind of found this statistic, which I thought was pretty interesting, that there was a study done recently that showed that a person born on or after 1990 is 2 to 4 times more likely to develop a colorectal cancer than a patient, or I'm sorry, than a person that was born in 1950. So, and then also they've noticed that 50% of patients with what they call early onset colorectal cancer, so early onset would be something that's diagnosed before the age of 50,
Okay.
that 1/2 of those patients were diagnosed under the age of 45. So it's really kind of interesting.
Yeah.
And, the question is are there just more people that have colorectal cancer, or are we picking up on this more because our screening has improved? So, I mean,
yeah.
it's kind of the chicken or the egg
Yeah.
concept.
But either way, the screening is there, so yeah.
Absolutely. And, it's personal preference for some.
Yep.
So,
Yeah.
yeah.
Prostate cancer screening, is that still, I know that was one that has changed, I know in my time since I've been at the hospital,
Correct.
that it's, yeah.
Yes, you are correct. So most expert groups no longer recommend a routine PSA screening.
Okay.
And again, that was kind of found as, over the years that those cancers that were detected with PSA were not deadly.
Gotcha.
And the early detection and the treatment of that didn't really change the outcomes for
Gotcha.
patients. So again, certainly, I know it's not something that's probably routinely ordered, but I know
Right.
at some of our community outreach.
Yeah, in the past we had, yeah.
Certainly if you feel that you would like to get a PSA level checked, you can talk to your primary care provider about that.
And I feel like that's kind of the bottom line as we're kind of starting to close in on wrapping up here, but is just have that, know your family history, share your family history and your personal history and any
Right.
symptoms or whatever with your primary care provider, and
Right.
kind of have that decision making between the two of you to figure out, because there are lots of things available. They're constantly looking at it to
Right.
make sure it's
Right.
accurate. Yeah.
Right. And
No,
go ahead.
No, you go.
I was going to say, because I get this question a lot, and it's in my day-to-day practice, but the million-dollar question is, do we have a blood test that will test for all different types of cancers? Well, we certainly have blood tests, biomarkers, tumor markers, that kind of thing that will test for, the presence of certain things when a patient has been diagnosed already with a
Right.
cancer.
Gotcha.
Can also kind
Yeah.
of diagnose if there's been a recurrence of a cancer. But is there that million-dollar gene panel that we can
Right.
run as a screening test
Yeah.
to look for all sorts of cancers? It's not ready for prime time yet, but I think in our lifetimes we will. I don't know.
Maybe
Oncology
so.
is ever changing, and I'm thinking that there's nothing approved as of yet, but never say never.
Never say
We could wake
never.
up tomorrow and
Yeah.
it could all be different. So.
Yeah. So for things, we had also talked before we started taping about like pancreatic cancer, or there's just certain kinds of cancer that there aren't screenings
Sure.
for. So for the things that there are screenings for, take advantage of those. Talk to
Absolutely.
your primary care provider. Any last minute thoughts that you just want to make sure somebody knows about screenings?
So essentially just making sure that you have a primary care provider that can alert you to these these screening tests when they're due. And, you know, in a nutshell, and it sounds very cliche, but cancer screening, early detection truly saves lives.
That's why we're here. All right. Thank you very much.
Yeah, thank you.
All right. Lots of information, always changing. That's why, honestly, the best thing is to, again, talk to your primary care provider. Hopefully this was helpful for you. And again, share the information with somebody you know and love. And until we meet again, I encourage you to make time for health.